One, we've been saying that the world is becoming a digital village for a while now. And if we're becoming a digital village, then it's important that we understand how to be citizens in this village. But the second reason I'm excited is because the person who will be taking this session is from the platinum sponsors of this event. And if you do not understand what that means, it means that they gave us a sizable amount of money. And because it is from that money that they are paying me to do this work I am doing here, I am particularly excited about this session. So please, a round of applause. We'd like to say thank you to the Digital Transformations for Health Lab. The African Director for Partnerships was with us yesterday, Dr. Enos Stevens George. He spoke virtually. And today they've sent us another representative who will be speaking on digital citizenship for health, Ms. Rachael Ogundipe. Please, man, can stand while I read your citation. Ms. Rachael Ogundipe is a public health professional and research consultant dedicated to advancing SDG 3 and promoting universal health coverage. She previously served as a research fellow at DTH-Lab, that's a Digital Transformation for Health Lab, and she currently serves as a healthcare scientist at the Tury Research Institute, where she leads and supports the evaluation of public health programs serving racially disadvantaged communities in Massachusetts, United States. As one of the African CDC Youth Digital Health Champions, she is committed to advancing the use of digital technologies to address public health challenges and improve access to care. Ladies and gentlemen, with a rousing ovation, Ms. Rachael Ogundipe. Welcome, ma. Please clap so that they will pay me my full money. Thank you very much. Welcome.
Hi, everyone. My name is Rachael, like you said, and thank you so much for having me. So it's going to be really short slide. Well, I told him that I wanted it to be interactive. I mean, I told the president I wanted it to be interactive. So please, if I'm going to ask a question, do we all have mobile phones? Do we all have access to internet? That's the importance of digital health, because I think I heard Doctor mention that, we don't see the importance of digital in health. And she also mentioned, I think we can use digital and we can use health. I think, based on what Eno said yesterday, in some situations, digital is not the solution. But among young people, we all have phones, we all have internet. We can at least try to make digital the solution to some extent. So this is why we're going to be introducing digital citizenship for health. But first, let me start with DTH-Lab. What does DTH-Lab do? Because I know you might be wondering, what do we do at DTH-Lab? DTH-Lab is a global consortium. We do research, policy, sit down with policymakers, review policies. We also do partnership, we partner with different organizations, and also at the center of everything that DTH-Lab does is young people. We are trying to make sure that young people are the future, young people have access to all the things that we do in health. Young people have access to it, and young people can contribute to it. These are some of the areas of work. We work in digital first health system, data and governance, like Eno said yesterday, digital determinants of health, and the one I'm going to speak on today is digital citizenship for health. Are we all familiar with digital literacy? I mean, we are doctors, so I'm not a doctor, but everyone here should be in medical line. We know digital literacy to some extent, we know health literacy, we know civic literacy. And then people are already teaching us, there should be digital citizenship. Does anyone have an idea of what digital citizenship is? Anybody? Please, like I said, we should interact. Does anyone have an idea? My sister in hijab, blue. Like, apart from the slide, from your point of view, what do you think digital citizenship is? Sorry, can someone get a mic?
The ability to use technology, like to function in society and to participate in society.
We are familiar with Twitter. Has anybody been bullied on Twitter before? Or any social account, or any social media? A lot of us are familiar with digital instruments. We know how to come online. But then, do you know how to stand up for yourself when you're online? Do you know how to report maybe somebody is bullying you, or there's a miscommunication, or somebody is posting something that is AI, or someone is posting something that is insulting? Do you know how to, oh, okay, this is what I'm supposed to do. I'm supposed to report the person. I'm supposed to block the person. I'm supposed to make sure that other people don't get to see this account. That is what we talk about when we're talking about digital citizenship, because you're taking ownership. You are there and you're taking ownership. But then there is, digital citizenship is like a very common thing. Like, people are trying to push it, you know, let it move, let people be aware, this, that. But then there is the health aspect in digital citizenship or digital literacy. There's the health literacy aspect, which is where digital citizenship for health comes in. Because a lot of people have talked about mental health. Most people, I mean, based on research, just being online is the reason why they have mental health issues. Maybe they are seeing somebody who is looking skinnier, or somebody who is looking like, you know, in some, I mean, there are research on body image and body image issues. There are research on depression. There are research on, oh, okay, I don't have enough people to talk to. Even as little as not having enough followers is enough reason for somebody to be like, oh, okay, I'm depressed, or I'm sad, or something. So what digital citizenship is trying to do is to introduce, what digital citizenship for health is trying to do is to introduce the health aspect and improving or building the competency of young people to understand digital health and civic literacy. So this is the new framework introducing health in digital citizenship. And this was based on the research that was done by the Lancet and Financial Times Commission. So we have also, at DTH-Lab, we've done several studies on why, on existing platforms and the absence of, you know, the lack of integration of digital health and civic literacy in these platforms. So during the research, we identified that despite the fact that there are several studies, I mean, we identified 38 platforms. Sorry, despite the fact that there are several platforms, which we identified 38 platforms, only 16 we're talking about civic literacy, 16 we're also talking about health literacy, and 17 on digital literacy. But then we try to look for platforms that actually integrate these three forms of literacy, and I think we only found three platforms that actually integrated digital literacy, health literacy, and civic literacy. So this is one of the platforms. This is DCRP. DCRP has several languages, up to 35 languages. These are the topics that you can learn when you have access to DCRP. Like they teach context, data, digital economy, digital literacy. But if you are going to look at this, and this is something that was done by an organization of Harvard. If you're going to look at this, the health aspect was just one, which is safety and well-being. And even if you go on the platform, you are not really going to see something on maybe mental health or something particularly related to health. They are just very on the surface things. Then this is another platform. This is Better Internet for Kids. This one was done by the European Union, or it was funded by the European Union. And they actually have things on digital, I think, health to some extent. I'm not sure if you can see what's on the screen. Sorry, I use glasses, so I barely see as well. But I think there's sextortion there. You know, when they're extorting you online for sexual content, they teach on these things. But then I think this platform lacks context on civic literacy. So there's this gap in existing platforms where they just focus on health literacy, or some focus on digital literacy or thereabouts, without integrating these three forms of literacy, despite the fact that all three are important. So from all the work that DTH-Lab has done, the plan is to build a platform that integrates all three forms of literacy going forward and make sure that it is user-centered and it is designed for the people that it is intended for, which is young people. So some of the activity and one question that I would like to ask anyone, if you could add only three features to a digital citizenship for health platform, what would they be? I mean, from the list here, if you could add 3. Because the point is for it to be interactive, for young people to be on it, for it to be useful. And it's not just another tool that is maybe being abandoned or something. So if you could add 3 that you think, oh, okay, I think these are really 3 really important features that a platform should have so that the people that it was built for can actually use it. Thank you.
Hi, good afternoon. So I think I would select the discussion forum, resource library, and maybe games and quizzes.
Okay, can you pick one and tell me why you think that one is really important?
Okay,
like
so
of the 3.
I can actually do it for the 3, yeah, but I think discussion forum, because it allows for socialization, and being that we are social beings, it basically mirrors what we have in reality and translates it to the digital platform that we are looking to create.
Thank you so much. I'm going to add another thing to that. In a discussion forum, I think one of the speakers here said, digital is what takes something from local to international. So when you have a discussion forum, you don't just have Nigerians there. I mean, you know Nigeria, you know LMIC, you know the problems, but then there's somebody else, maybe in Europe, maybe in US, that knows the problem differently from how you know it. And then you can talk about it, you can discuss, you can share your opinion, you can argue, you can meet people. That's one of why I think, a discussion forum is really important. Please, somebody else, a female. She.
Good afternoon.
Hi.
I would think discussion forum, experts, Q&A, and a resource library. Those would be important. Then for the most important ones, I would think an expert Q&A would be very important, because in that way, maybe access to the resource library, the layman may not be able to interpret it so easily. So an expert would be able to bring it down to their level.
Thank you so much. Okay, something that I forgot to say that she actually mentioned, most of these platforms are actually like a repository. So they just have resource libraries, but then there are things there that you can't even maybe interact with or speak to people about or share or ask questions. So they're just there, like things that you can literally find online. So, which is really important, which I think what she said was really important. Having an expert that you can ask questions. I saw this, what do you think about it? Is also one of the features that should be on a platform. So, activity, please, if you can help me with your phones, it's just 3 questions. There's going to be a QR code, you can scan it. Yeah, so I'm supposed to present from my laptop. Okay, because I think because I sent it, it's not actually showing. It's supposed to be interactive, where I ask questions and it comes up. Okay, maybe we'll just do this the way we... No, that's not possible, I'm sorry. How do we do it?
Is it live?
Yeah, it's like... Okay, I don't think we'll be able to do the last aspect. I thought I'll be able to share my screen from my laptop, because it's supposed to be like a live activity. No, they are the last 3. I think that's it. So, nevertheless, thank you so much for having me and listening to my presentation. If you have questions... If you have questions, I can take questions.
Thank you so much, Rachael, for that amazing session. We'd now like to take questions for her. So if you have questions for her, please step forward. Take a few questions. Oh, okay, so you can just pass it. If you have a question, you can just signify. Okay.
All right. Hi. Thank you very much for your presentation. So,
sorry. Before you start, just so that it's not rowdy, you can just step forward. If you have a question, so that we're sure, so that we don't have to be moving the mic up and down. You can just step forward, but you can ask yours. No, you can ask yours from there. Then the others step forward.
All right. Thank you very much for the presentation. I think from what we've learned today, we've seen just how, in as much as we're trying to intervene and make the world a better place using technology, we still have to tailor, we still have to like find some in-person type of interventions, but we all still agree that technology is the future. So I wanted to get your perspective on digital innovations themselves. So two things tend to occur around digital innovations. One, privacy, and can you hear me? Yes, so privacy. Basically, people being scared about their data.
Okay, privacy.
Yes, data security, data privacy, and all. So I wanted to ask, what's your perspective on that, and what are some measures that innovators should include when creating ideas around that? Then secondly, what are some safety measures? Because when you put a platform and you allow the public to interact with it, especially with something as sensitive as health, where you don't just want people to take information without there being some regulation. So from your perspective, what do you think are some measures that health innovators can put in place to ensure that this information don't get misinterpreted or misused by users? Thank you.
Thank you so much. Let me quickly answer. Have we ever interacted with like a digital platform and they told you to agree to something? You don't just create something without backing it up legally. So if I don't read it, honestly, I won't lie, I don't read it. I just scroll and I just click agree. But then that is something that secures you. And when you know that, oh, if this person uses it wrongly, you can sue their ass. Because you agree to something, I mean, reading it before you agree anyway, but then you agreed to something and they're actually owning up to their hand. But then you also talk about the part of privacy, which is one of the things that I think I should have talked about, or maybe I talked about when we were doing this platform, because some of these platforms that we reviewed, they don't have a way that you can have a personalized account. So if I cannot personalize your website to my, like to creating an account, having a login, securing the login, I can even go the extra mile to do two-factor authentication to make sure nobody has access to it. So that when I'm asking a question, oh, okay, this is going on with me, how do I solve it? I know that before somebody goes into that account, they have to probably take a code from my email, take a code from my mobile phone, and all those kind of things. So it gives me this sense of, oh, okay, nobody can have access to this account. Like, I can literally ask anything, I can do anything, and I can interact. Then the agreement part also comes on the side of the developer, because you know that you agree to something and they have to own up to their end. So if you're sharing something that is private that I put on your platform, I can sue you and I can get money out of it. So I hope that answers your question.
Thank you so much, Rachael. Please, can we get her a mic?
Thank you so much, ma'am, for your presentation. So I just want to confirm. So after we've listened to this presentation, what are the steps we can take right now to get ourselves, improve our digital citizenship right now? What are the things we can do with this information?
Okay,
thank you so much.
Sorry, what's your name?
Peace.
Peace. Oh,
Yeah.
Thank you, Peace. Well, I think there are a lot of groups now. A lot of small groups, big groups, network. I mean, I think I'm a part of like 2 digital network myself. There is the Africa CDC Youth Network for Digital Health. There is also the one by DTH-Lab. If you maybe go on LinkedIn, you can check for My Health Futures. So you check My Health Futures. You also check African CDC Digital Health Network, or Youth Digital Health Network. Like, try as much as possible to join digital health networks, and that is how you can maybe have access to information that they are sharing, have access to whatever maybe innovation that they are trying to do, and you can also get involved with it. I hope that answers the question. Thank you.
All the questions. Does anybody else have a question? Okay, a round of applause. Thank you so much. Thank you so much, Ms. Rachael, and thank you to the Digital Transformation for Health Lab. Thank you for your contributions, both in cash and kind, to the success of this event. Another round of applause for her, please. No, that's not for my platinum sponsors. Thank you very much. Thank you very much. Thank you. Thank you. Okay, so right about now, we will be proceeding on a very brief break and poster presentation. So the poster presentation will be happening simultaneously with the break. Okay, so we have about 15-20 minutes for that. Just as we had the break yesterday, we'll be exiting the hall. You can get something to quickly munch on or drink. But simultaneously, within that time, the major thing that will be happening within that time is a poster presentation. How many of us know what a poster is? If you know what a poster is, can I see you wave?